Hi, I'm Judith Heller, and I'm proud to oversee physician recruitment at the Northwell Health System. I'm pleased to partner with our clinical leaders. Now I'd like to share with you their vision for growth.
The pediatric service line covers a large geographic area. I mean, we are out east in Suffolk County. We come through Nassau, Queens, Brooklyn, and Staten Island into Manhattan, and then we extend up north to Westchester and brought in a new practice in Rockland County. We have our network of primary care practices, and if you're a pediatrician who's looking to join us, one of the things that pediatricians sometimes struggle with in new practices, who do I send my patients to? Well, being part of a large pediatric service line, we have all that.
We have really easy access to other physicians, whether within other outpatient practices, if we need help with certain things, or specialties as well.
All of our physicians are on the same electronic health record. Everything is in the same EHR. So if I send somebody to urology, I just open the child's chart and I see the urologist's note. Communication with the specialist, because we're all on the same record, is great. Even when we're seeing newborns, I have access to the newborn record. They were born at a Northwell hospital. I know what happened in the delivery room. I know what happened in the nursery before the baby went home. It's all at my fingertips.
We don't have to be waiting for a referral. We don't know when a patient gets in. If we need something done urgently, we can reach out to the different departments right away, which is very useful.
Being part of a large integrated healthcare delivery system, our pediatricians can very, very easily Teams chat an endocrinologist, a pediatric urologist. We're all interconnected. We really stress communication.
And that's important for someone who's not in the hospital, where I'm not physically on site with some of these doctors day to day. And as someone who's referring patients to those people, just knowing that when you do send them out there, they're going to get really good care there.
I think when you're in a very big community like Northwell, you can think that it's easy to get lost within it, but you're within your niche. And then from there, you can also grow and reach out to other groups within Northwell.
Within the pediatric service line, we have the head of pediatrics who will always be constantly checking in with us. He's the one that provides us a lot of email updates. He'll come in person to the practices as well, just to discuss if there's any new changes or any questions that we have, if there's any new resources available to us. So we always feel like we have the support of the pediatric service line.
I always emphasize the benefits package that Northwell Health provides to physicians. And when I talk to recruits, it's not just what's your salary, it's what's your total compensation. And total compensation, in a large part, is your benefits. You join Northwell, you are going to feel supported. We have dedicated people on our team in the pediatric service line who really shepherd you through that onboarding process. Northwell Health has a physician concierge team that's really a great added benefit of working for a large health system. Anytime that we have a new physician starting with us, and that could be somebody who's maybe been in practice elsewhere for 5 or 10 years, or somebody right out of residency training, I want to identify if there's any concerns, and I say from the get-go, I'm a resource for you. We're mentoring younger pediatric trainees, we're mentoring medical students. One of the nice things about our practice network and what Northwell has put together is they have, over the years, have practices aligned with them. And in some cases, you have a seasoned pediatrician who's practiced for 30 years. And so putting a new physician, a new pediatrician in with that experienced pediatrician in the same office is an ideal situation.
Coming through the residency program, we had a lot of different research projects available to us. You also had the different mentors who, if you felt very strongly about a certain topic or a certain population, you can gear your own project and they would help you work on that.
The Zucker School of Medicine was started by both Northwell Health and Hofstra University, so being part of an academic medical center tied to a medical school gives you infinite resources. All of the students at Zucker, when they have to do their pediatrics, they come to Cohen's and they come to the Cohen's offices.
For those of us who do have students with us, we are then eligible to participate and actually become faculty within the Hofstra University.
One of the things that makes Northwell unique is the diversity of patients that we care for. You have an opportunity to care for patients who have literally come to the U.S. from all over the world. It's an advantage as a physician to care for families from different cultures, from different backgrounds, and that's something that sets Northwell apart.
You never want to see just like one note. You want the diversity to build growth. So you do see common things all the time, but then it's those rare things that you see and that you can kind of talk with the other physicians about, talk with the specialists about, and kind of grow in that way. And that's really nice to see.
It doesn't matter if somebody's coming right out of residency training or they've maybe been in a practice for 10 years and now they're looking to make a change. For me, what's important is that they are passionate about caring for children. We have the, I say, privilege to care for somebody from when they're born as a newborn until potentially going off to college. And that's not something that you get to do in medicine in a lot of other areas.
There is a pride in being able to say that I work for Northwell because of the reputation that the organization holds. For those of us who are in healthcare, we know that this is not an easy thing to do. There are good days, there are bad days, but can we show up every day? Can we continue to give of ourselves to make the patient care experience a bit better for those who come through our doors? Think down the line, where do you see yourself? What do you envision doing with your career? Northwell has great opportunities really for whatever it is that you might envision yourself doing. And when you have a team that supports and wants to support you, I think it makes it that much better.